So thank you all for coming in today. My name is Rosa and I run the clinic at Life Pharmacy Birkenhead, and it is called Injectables BH, and we specialise in aesthetic injections and medicine for the general population. We're here to explore the transformative world of aesthetic injections and specifically focusing on neuromodulators or neurotoxins like Xeomin and skin boosters such as the Belotero-Revive and bio-remodelers such as Profhilo. These amazing treatments have revolutionized non-surgical facial rejuvenation that offers safe, effective and accessible options for everyone to enhance their natural beauty. So what happens to us as we age? There's basically 5 processes that we go through as we all age. The first is we have collagen and elastin loss. Collagen and elastins are proteins that provide structure, strength and elasticity to skin. As we age, the body produces less collagen and elastin, and the existing fibers that we already have begin to break down. This leads to the skin becoming thinner, less firm and more prone to wrinkles. Elastin helps the skin snap back. After being stretched, the skin should usually snap back quite quickly. This diminishes over time, which makes the skin sag and you lose that youthful bounce that we all normally have. The second thing that happens is called fat redistribution. So the fat on the face, and specifically around the cheeks and the eyes, they start to decrease and shift downward. This can lead to hollowing areas under the eyes, around the cheeks and in the temples. This sort of hollowing is just the fat moving away from where it used to be, and around the jowls is where we get that sort of sagging, particularly in these 2 areas. The third thing is a decrease in hyaluronic acid. Hyaluronic acid is a substance that naturally occurs in the skin, and it helps to retain moisture and the skin to stay plump. As we age, the production of hyaluronic acid comes down, and it means we lose volume and the skin becomes more dry. The contribution that hyaluronic has to our skin is that it keeps and retains moisture in there. So as we lose that over time, moisture is lost far quicker through our skin, and this leads to fine lines and wrinkles. The fourth thing that we suffer a lot from, and particularly New Zealand and Australia, is sun damage and environmental factors. So over time, exposure to the sun's UV rays can cause damage to the skin's actual DNA, which speeds up the breakdown of collagen and elastin. Free radicals from the pollution and environmental factors contribute to premature aging as well by damaging these cells, and it accelerates the process of aging. This is something that is a major contributor to premature aging in New Zealand and Australia as compared to our UK, European and US counterparts. This is because we have a thinner ozone layer over here, and so we are exposed to UV radiation a lot more than they are. The fifth and final thing is muscle activity and repetitive movements. This is movements like smiling, squinting and frowning. These are called dynamic wrinkles, where when we smile, we get these lines that come up, but when we stop, they go away. Over time, these dynamic wrinkles or lines will become what we call static, which means after you've stopped smiling or squinting or frowning, you will get a remainder of soft lines in those areas. The forehead, around the eyes, where we call the crow's feet, and between the eyebrows are the most affected and are consequently the most highly treated areas with anti-wrinkle injections. So a combined effect of reduced collagen elastin, hyaluronic acid and fat redistribution results in the skin appearing thinner, drier, less elastic, that leads to wrinkles, sagging and volume loss over time. However, these changes are very natural and are part of the aging process, but this is where aesthetic injectables can help address each and every one of these issues. We can replenish volume loss, provide hydration, and stimulate more collagen production. So what are the 3 main things that we use for these things? Aesthetic injectables that we're going to discuss today will encompass 3 categories to address the main points. The first are neurotoxins or neuromodulators like Xeomin and Botox. These temporarily relax the muscles to smooth wrinkles. The second are skin boosters such as Profhilo and Belotero-Revive. There is many around, but these are probably the top 2, and there is another one called Sunkiss as well. These help to restore the skin hydration, improve texture, and they actually promote your own skin to start producing its own elastin and collagen. The third are dermal fillers. These essentially just add volume and help to enhance contours such as cheekbones, lips. Some people have it in their temple to help with that hollowing effect. These treatments are designed to rejuvenate the skin and enhance facial features without the need for invasive surgery. They are safe and easy procedures, and anyone of any age or gender can have them. In fact, as of 2022, an estimated 1.37 million men globally received Botox treatments. That represents roughly about 15% of all Botox procedures worldwide. From 2000 to 2020, this was an increase of 381%. So neurotoxins like Xeomin basically block the nerve signals to the muscles, and they reduce the contractions that cause those wrinkles. Without the signal to contract, the injected muscle relaxes and it leads to a more smoother appearance. This effect is temporary and it typically lasts for a few months, and then people will need to top up if they want to continue with it. As the nerve endings then regenerate themselves, the movement comes back into the muscle again, and that's why people will keep up with 3 to 4 monthly maintenance. These are administered by certified professionals, and neurotoxins have a strong safety record and deliver natural-looking results if done appropriately and properly. This is by far the most used aesthetic injectable in the injectables arena. A quick basic history of neurotoxins is they used to be used medically to help with strabismus, which is a condition where the eyes are not aligned properly and will look in different directions at any one time. Then in 1989, a doctor by the name of Richard Clark used botulinum toxin to treat facial wrinkles after realizing this was a positive side effect that they found when injecting people for these conditions. In 2002, the FDA finally approved it for cosmetic use, and this became a massive revolution for the aesthetic medicine world. In 2023, globally, 9 million people received Botox treatments. The most common age group is between 35 to 50-year-olds, who make up nearly half of all the treatments. However, younger patients in their 20s are also increasingly opting for the preventative treatment. In New Zealand, the 3 main ones we use are Xeomin, Botox, and Dysport. So what is Xeomin? So at Life Pharmacy Birkenhead in my clinic, we actively have chosen Xeomin as our product for an anti-wrinkle injection. And the reason is that it contains no complexing proteins. It's essentially called the naked formulation, and this reduces the risk of developing antibodies, and it allows you to have a more consistent result over time. This product is produced by Merz Pharmaceuticals, who are located in Frankfurt, Germany, and they are a global leader in aesthetic medicine. Xeomin has been used globally for the past decade. The other thing that we use are skin boosters. So the first one that we use is a skin booster called Profhilo, and this comes in 2 different types. The first one is a standard Profhilo, and this is used with 5 injection points through the face, and it is one of the purest forms of hyaluronic acid that you will get, so it has no chemical agents added to it. This allows it to have quite a runny consistency, almost like honey. As we inject these points, within 15 minutes, it runs and it covers your whole face. This is basically what they do. So unlike traditional fillers, Profhilo spreads evenly under the skin to provide deep hydration and improve the texture and elasticity of skin. It is administered in 2 sessions, 1 month apart. Profhilo is suitable for all areas, such as the face, the neck, the décolletage, the hands, but there is a brochure, and you will see in that brochure people use it on the stomach, on the knees, on the legs, basically anywhere that skin is sagging. Profhilo falls under a category called bio-remodelling injections. Unlike dermal fillers that add volume, bio-remodelling injections focus on hydrating and rejuvenating the skin from within. Bioremodeler injections are minimally invasive and they require no downtime. They're a good alternative to surgical procedures for those who want to increase their skin quality and reduce the signs of aging. The results of these are quite gradual and can take typically several months because, as we said, it's not like a filler where you get instant volume. It goes in there and it actually encourages your own body and skin to build its own collagen and elastin, which, as we discussed through the aging process, falls off as we get older. The results usually last for about 9 months, so it's really an annual sort of treatment that you will have, but a lot of people will have maintenance treatment, so they will come yearly for it, and the more often that you come for it, the more your skin will produce its own collagen and elastin. This also has the effect of reducing fine lines and wrinkles over time as well, in sort of these areas and marionette lines, which are big areas for women. The next booster that we look at is Belotero-Revive. Belotero-Revive is a hyaluronic acid just like Profhilo, but it also has glycerol added to it, and this enhances skin hydration, elasticity, but it also helps with women who suffer from hyperpigmentation as well. The glycerol is actually, funnily enough, the ingredient that helps with the hyperpigmentation. This injectable improves the skin tone, reduces fine lines, and it gives a natural radiant appearance. Clinical studies have shown that Belotero-Revive improves skin hydration and elasticity with results also lasting up to 9 months. Over 80% of patients have reported satisfaction with their results by week 24. So again, unlike filler, which is immediate volume filling in the face, this allows your own skin to produce its own elastin collagen, and it also helps with hyperpigmentation over time. So by week 24 is when the results will peak. This can be, yes. That's when you get sunspots. Yes. And pigmentation occurs with age, but it can also occur with people who are in the sun a lot, who do a lot of gardening. One thing is glasses. You get people that get it here because the sun comes in, magnifies, and they get it through here. You get it through pregnancy. It's really common, and it's actually hormonal. So I feel like there isn't a lot of us that get away with not getting hyperpigmentation at some point in our lives. But the glycerol in this is quite good. This one's a little bit more invasive in terms of compared to the Profhilo, which needs 5 injection points. This one has several. But what that does is the injections going in and out where we place the product also allows the skin to go, oh, I feel like there's trauma, and it starts to build its own collagen and it helps to repair. So what we're actually doing is we're teaching your skin to rebuild it rather than artificially putting in, volumizing HAs, which is hyaluronic acids, which is great, but can give a pillowed look over time. So skin boosters, like the Profhilo and Belotero, they deliver nutrients and hydrogen to the skin that helps to improve texture and elasticity. So that was that bounce back that you get in the hydration. These treatments are ideal for people with dry, dull, and aging skin. They provide enhanced skin quality and reduce fine lines and just give an overall enhanced, improved appearance. Okay, we'll keep it on that, that's fine. So the benefits of aesthetic injections are that they avoid risk and recovery time that is associated with surgery. The minimal downtime means that these treatments can be done at any time. They can be done in the lunch hours, they can be done sort of on a weekend, they can be done first thing in the morning. The results of these are pretty quick when it comes to anti-wrinkle injectables. So Xeomin, for example, by day 3 you should feel it beginning to kick in, and by day 14 you will see the full results of what it's going to look like. So traditionally, when a patient comes in and we do a treatment, we do a follow-up in 2 weeks, and if they need any tweaking or any extra sort of units around the place, that's when we would put it in, because that's when we will see what the final result is. And in my clinic, the way that I do it is, if the patient goes by my recommended dosing, because there is recommended sort of standard dosing for different areas, and they're still not happy, then I'm happy to provide extra use units for free on the top up. It is very important that these injectables are administered by professionals who have had training for it. And if you do that, they have a very strong safety record. When it's performed correctly, the results can be subtle and can enhance natural features. And they last for several months. And in time, you can adjust to what you want. So the main areas that we do in the upper face, which is what we call on-label use, is the frown, the crow's feet, and the forehead. And when we do these areas, they all have different effects. So if you do the crows, it's generally in this area, and the frown, it has a lifting effect on the eyebrows as well. So people who sort of find that they're getting a bit of sagging and drooping here, it helps to lift that. The forehead, however, will counteract that, because your forehead muscles are actually moving to pull everything up. But if you want to take the wrinkles away, it pushes it down a little bit. So it's important to talk it through in your consultation so that the injector can tell you how it's going to affect your eyebrow placement, for example. Sort of, are you going to get moon crescents through here, and to reduce all of that. The second thing that we do here that you have to have special training for is called off-label use, which is the lower part of the face. So we do bunny lines, which is these sort of lines here. Gummy smile, some people have a really gummy smile, so we can do that. We do a lip flip. That's very popular with people who don't want filler in their lips, but they do still want to have a little bit of fullness there. We do dimple chin, and we also do the jawline and the neck platysmal bands. So what they do is it helps to lift this area. So the jowling effect that we were talking about with the sagging, these will help to counteract that. And we also do teeth grinding, which is your masseter muscles. If you bite down really hard and put your finger there, it's this muscle here. By inactivating that, it stops you from grinding your teeth at night, but it also has, as a side effect, a slimming look onto the face as well. They do require higher doses, but they do also last for a little bit longer as well. I don't normally do befores and afters of my patients because just of privacy, and even though you block people's faces and that sort of thing, they may not want you to see it, but these are actually from the company that they've put out. So the first lady here has had her forehead done, and that's her trying to lift her eyebrows there, and that's her from before. Sorry. And that is the frown line. So this lady here is actually trying to frown there. She's not just sitting there, but that's the frown line there. And if you can see, it's actually helped to lift the tail of her eyebrows as well. And this is a lady that they used as a case study for Profhilo. So Profhilo is made by a company called EPSA, which is an Italian company. It's kind of hard to see, like you have to look for a very long time. So see, she's got this quite deep marionette line here. After 4 weeks, and that's after 8 weeks, it's reducing quite a bit. But as we said with the skin boosters, they do take a longer time. So even these lines here, and that's 8 weeks, have actually cleared. And this is her full front. So you can see that she's got, you don't do it in the upper part of the face, by the way. So she's sort of, we're looking from here down for her. So all these areas gradually have improved. So this is only after 8 weeks. With this one, after your second treatment, it's probably going to take a good 24 weeks for you to see the full results. So she's going to keep improving, but these were sort of within 8 weeks. And this is where we talked about, these are the injection points. It's very quick, it's very minimal. And this lady has had it, and this is her, if you're looking an infrared, and this is how quickly it has spread within 15 minutes. Because we talked about it being a very pure hyaluronic acid. So essentially, once you put these points in, it just flows down and covers your whole face. So we don't need to keep pricking you everywhere. Those 5 will allow it to go through. And again, after 2, so this is after 1 treatment of hers, and then after 2 treatments, within the next sort of 10 to 24 weeks is when she will peak with her results. And that's all that I've got. Is there any other questions that you have about injectables?
I have a very silly one that just came to my mind.
Nothing silly ever.
But I know there's separate things as well. But
No.
if you sweat too much
Yes.
every day,
Yes.
that can have any.
No, not silly at all. It sounds very logical to think that. So we actually put it directly into the muscle. So we're going several layers deep. There's a lot of layers there, and it doesn't feel it when you touch the forehead. So we're hitting the muscle. Your sweat glands are above that. So what we do say, though, is no exercise within 24 hours of having the procedure done. And the reason for that is it can help it spread. So another reason that I really like Xeomin is because it's very precise. So if I was to put it here for you, it would help these wrinkles. It's not going to constantly spread where you might get this sort of look into the eye. And so we say no exercise because that will make it spread. So no, you're quite right in one way that it can, but your glands are above the muscle, so we're going quite deep in to help relax that muscle, which causes a contraction. Sure. No. So like I said before, it's so with the Xeomin, what we're doing is we're relaxing that muscle by stopping signals getting there to say contract. But your nerves regenerate. They're constantly regenerating. So within 3 months, it's entirely gone. So it's quite good because it's temporary, and if you don't like it, you don't have to do it again. But then it's also not great because if you love it, it means you have to keep doing it. But maintenance is actually really important. So the whole concept is that if you were to start, say, with 20 units, which is a very standard for the frown line, the idea is that over time you can reduce the number of units you need because you no longer are using that muscle. So those lines have decreased. And I've got patients now that have reduced because they've stayed with it. Some people will choose to do it every 6 months, and again, that's entirely a personal decision, but it does mean we do maintain those units each time. So no, I've actually got vouchers here where you can actually take them and you get a 20% discount. So no, it's not with. I don't actually have my calculator here because my son's taken my phone, but if you use your voucher, I think it comes down to sort of $12 a unit, and so for the forehead, for example, that's 20 units times 12. Depending on the number that you need, it can be, but it is every sort of 3 to 4 months. The skin boosters are a little bit more expensive. You do need, for Profhilo, for example, 2 treatments that do last a full year. So that's about, I think, $950 for 2 treatments, but that's an annual thing. And the same with Belotero. Hmm?
Can you, what you use now, you're getting Botox or fillers or
So the barcodes, we've got two. I would recommend the boosters. I wouldn't do a filler in the area because what filler does is it's really lovely when you put it, like for the lips, I love filler. I think it's amazing because you want full lips. But when it comes to other areas and it fills it in, filler, your body will actually metabolize it over time and it will go away. They're called complexing because I've got a chemical added to them which makes them dissolve. However, it's not 100%. So each time that you would do it, you'd have a little bit left over. That's when you lead to the puffiness by your third. What I have done for, so one of my patients actually, she gets a lip flip and she's perfectly happy with that. But I've got another two who actually, one does Profhilo and one does Belotero, where they're actually made for that area. So what it does is it's not going to give you this quick, oh, it's filled in and it's gone, but over time it does help them to go away and they do maintain it. And I think that's better because that's your skin, your body doing it, as opposed to artificially making that happen and then leading to that sort of a pillowy look. The lip flip is where we put 4 points of Botox in around the lips, and it just very subtly helps to curl the lip up. So you're not adding volume to the lip, you're not getting that filler look if you don't want it, but it is quite subtle and it helps just to literally flips your lip up so it looks a little bit more full with more definition. No, that would be filler. Yeah, that would be filler. And again, filler has its place, and some people do love that look. But this is far more subtle. So you're not adding volume. It's literally your own muscles sort of relaxing to allow that flip. Sure.
Can you define what you mean by 20 units?
20 units. So when you use Dysport and Botox use the same dosing, and Dysport uses a different one. So for Dysport, where you would use 10 units, in Xeomin and in Botox you would use 3. So we'll stick to the units within the Botox and the Xeomin because that's what we use. Traditionally, you need a certain amount of units for each area to help the muscles relax. So you start with, for example, around the eyes is 10 each. The frown is 20. That's very standard. That's from studies and people having done it over time in scientific papers. However, that doesn't necessarily mean that that's fit for everyone. So if you came to me and you are somebody who concentrates like this a lot and you've got that deep line or two here, then I would probably increase that, but only by, that's where we go to 1, 2, 3 units up, not by a lot. So yeah, that's what we mean by units. That's like a dose that you will need to help relax that muscle effectively enough. There is actually something called baby tox that a lot of people use. So again, if we take the frown area as an example, 20 units being standard, baby tox is 16 units where they give you a little bit less. I don't mind it, and I think if somebody wants to do that, that's their individual right to choose that. However, it wears off faster and you need to come back for more units. So in the long run, it's actually more expensive. But again, if somebody sort of doesn't want a lot, then they can choose to do that. So definitely, yeah. It's just a dosing standard that we use. I should have actually bought my syringe. So what it basically means is more for the injector, a certain line to a certain line is 1 unit. That's right, it's a quantity on each syringe, but we all use sort of different ones. So that's why they use a unit, because if you've got a different syringe, your lines will be different to that. So they wouldn't say 1 mil, for example. Yeah. Sure, thanks. I've got some handouts here if you want to read more about Xeomin or Profhilo. I have got some vouchers for anybody who came in today and like a treatment list, and just some packages if you guys want to grab some and read more. And if you want to get a hold of me, my number is on there. All my consultations are free. You don't have to pay to come and see me, and I can do a write-up for you on a consult and what it would look like. And you can choose to come back and have the treatment if you wish. Yeah.
Do you operate out of Life Pharmacy?
Life Pharmacy, I've got a clinic in there, yes. Of course.
You have a clinic